representing tonight, speaking on behalf of our social care members. So, you know, GMB, we are one of the main unions operating within social care, and our biggest campaign for a long time is pay justice. And right at the heart of pay justice for the social care workforce is full sick pay. We need to remove the expectation that as a social care worker, you're going to receive the national minimum wage and you're not going to be entitled to sick pay. Sarah stole my line earlier, but, you know, during COVID at last, social workers, you know, the social care workforce were seen as the key workers that we always knew they were. You know, we didn't need a pandemic to understand the importance of their role in our society. Much of the social care workforce continued to work throughout the whole of COVID, at times putting their own lives on the line in order to continue providing the care that was needed by some of our most vulnerable people in society. They did all of this whilst being denied access to PPE, denied access to testing, and being denied access to sick pay should they need it. From the very start of COVID, GMB and other unions campaigned, and we won. Our social care members have benefited, and it shows exactly how we can actually influence the decisions that this government make and what they implement. We secured payment of statutory sick pay from day one of sickness. We secured free car parking for health and social care workers. We secured an extension of PPE guidance to include all of the social care workforce. They'd originally been excluded from public health guidance on PPE during COVID. We secured furlough for staff working in social care that couldn't afford to shield when being medically advised to do so. They couldn't afford the SSP for 12 weeks, and we got them furlough. We've got them access or a right to access regular testing, although issues remain with that. And then we've secured an additional £600 million funding for social care, specifically for infection prevention and control measures. And this is where our current campaign and where your campaign leads into. GMB believes that the biggest infection prevention and control measure you can put in place in social care is the payment of full and normal pay when sick. Sick pay is crucial if people are to adhere to the government's self-isolation guidance. But the vast majority, 97% of the social care workforce, are only entitled to SSP, which is £95 a week. The government's advice is almost impossible for the workforce to follow. An average care worker loses £252 per week if they claim SSP. Workers are therefore put in an unbearable dilemma of having to choose between going to work ill, potentially putting the health of those that they care for in danger, or staying at home and not being able to put food on the table. We've recently done a survey of 1,000 GMB members in social care. 81% said they would be forced into work sick due to not being able to survive on SSP. 8% said they've been forced to borrow money in order to survive on SSP. It's unrealistic to expect people to be able to survive on that amount of money. And I know it was referred to earlier about the government's recognition of that, but Matt Hancock, even yesterday, admitted in the Health and Social Care Committee in Parliament that people could not be expected to survive on that amount of money. And yet this government repeatedly failed to rectify this problem. So the GMB campaign right now is we're ensuring or trying to ensure that the additional infection control money gets to the workers on the front line. So the funding's been allocated to local authorities to allocate to care providers in their area. However, we've already got reports of care providers not being able to access the funding due to complexities within the system of application. But we've also got examples of care providers who've got the money and are still not paying sick pay to their staff. So for our campaign right now, if you go online, we've got a petition on the GMB website to Helen Whately demanding full sick pay for all social care workers. And we've also got a campaign video on our Facebook page, which we're encouraging people to share. But I'm going to repeat the message that quite a few of you have already said tonight. We need you all to join a union and get involved in the campaigns. All of the campaigns, the TUC links have been shared many a time, so please do that and encourage everyone else to do it. The issue of sick pay has always been a problem in social care, and COVID has just highlighted it even more. No contractual sick pay or access to only SSP drives the social care workforce even further into poverty. This is a workforce predominantly made up of women and people from Black, Asian and minority ethnic backgrounds. The additional £600 million funding is only ever intended to address COVID costs, and new funding settlement is still needed to address the deep structural problems within adult social care, and right at the heart of that is sick pay. Full sick pay must become a contractual right. There are 110,000 vacancies in social care prior to COVID, with an average staff turnover of 30% each year. Addressing the issue of sick pay helps address recruitment and retention crisis within our social care system and give the social care workforce the pay justice they deserve. So finally, just to thank you again for the opportunity to speak to you all tonight. Thank you for asking us to be involved in this crucial campaign. And I really look forward to myself and GMB being able to work with yourselves to secure sick pay for all moving forwards.